Here I was telling the preductal target saturation. The preductal means before the ductus arteriosus arises from the aorta. So usually it is on the right side. So right, we have to target the right wrist saturation. Okay, so the pulse ox is connected to the right hand. Okay, right hand of the baby, right wrist of the baby. Okay, why onto the right side? Because the blood supply to the brain and to the right side is through the same limb, preductal limb. So we will know what is the saturation of the saturation of the blood supply to the brain. Okay, so hence we target the preductal saturation. So this is what I was telling. At 1 minute is it 60 to 65, and gradually it progresses. By 10 minutes it is 80 to 85%. So at 3 minutes, if the saturation is 80%, then we need not start on oxygen. This is an example which I have given. So positive pressure ventilation. Here it is the main intervention of the neonatal resuscitation. It is a form of assisted ventilation. Okay, if there isn't any improvement in the heart rate. Okay, where all we do positive pressure ventilation, these are the things. Okay, and after doing positive pressure ventilation, when then we check for the chest wall movements with every bagging, whether the chest wall on both sides is moving equally and properly. And to maintain the heart rate of more than 100 is our target. Now, what are the devices we use? The bag and mask, the regular bag and mask, the T-piece resuscitator, which I've showed, and sorry, this is flow meter. Okay, sorry for the wrong type again here. See, again we position the baby in sniffing position with shoulder roll under. Yeah, this is the position. Now, how do we uh, position the mask is, see, this is a appropriate size mask, where the first we attach the lower end of the mask towards the chin, at the chin. Okay, we start from here, and then we place the mask upwards and cover the mouth and nose. Okay, and just below the eyes. Okay, it should not cover the eyes. Okay, that is the proper the positioning. Okay, and with here it is thumb and index finger, and the rest of the three fingers are usually to lift the jaw. So that is how. So this is E C clamp. Okay, this is E and C clamp. Okay, the mask is held with thumb and index finger, and E is below the jaw. Okay, this is EC clamp. Okay, and then we start on, first we secure the mask, and then we start on mask bagging. Okay, so this is the most important position, and uh, yeah, so this is self-inflating bag, also called as bag and mask. Okay, why is it called self-inflating bag? Because it inflates by itself. It doesn't require any compressed oxygen source. Okay, at room air also it will inflate by itself. Okay, so this is the self-inflating bag, which is most commonly used. This is flow inflating bag. Here the oxygen flow, compressed oxygen source is required to achieve a uh, proper seal. Yeah, first of all compressed source, the second most important is proper seal around the mouth. Okay, then only it will expand. Okay, this flow inflating bag expands. And this is T-based resuscitator. Okay, T-based resuscitator. So what are the differences between these three? Self-inflating bag, flow inflating, and T-based resuscitator. Here, as I've already told, doesn't require any compressed gas source. Okay, but these two, flow inflating and the T-based resuscitator, requires a compressed gas source for inflating the bag. Now, here, even if you do not achieve a proper seal, it will expand, the bag will expand. Okay, But here, there it requires a proper seal around the mouth and nose. Then only it will expand. Now, PIP, and what are the things which we usually aim during bag and mask is PIP and PEEP. Okay, PIP is positive inspiratory pressure. Okay, this is the highest peak pressure. Okay, which helps in inflating. Previously, they used to say in an RP, at least for 5 seconds you have to bag. Okay, squeeze the bag. Okay, but now the guidelines doesn't say it anymore. Okay, so you need not like 5 seconds is the minimum basic time to squeeze the bag. It is not recommended further. But how hard and how long you squeeze is the PEEP, determines the PEEP. Okay, in bag and self-inflating bag or the regular bag and mask. But in flow inflating bag, it is not the means squeeze the how hard you squeeze. It is also dependent upon the flow of incoming gas. If you say if you set it at 10 liters per minute or 15 liters per minute, again the PEEP increases. Okay, as well as the squeeze. Okay, but here in TP's resuscitator, here you see, here there are two knobs. Okay, one is for PIP and one is for PEEP. PEEP is here, PEEP is here. Okay, then the PIP is can be manually set here. Okay, what is the PIP which you want to achieve? So that can be indicated here. Okay. Now this is for PIP. The PEEP is again set manually, again in TP resuscitator, but here it is by adjusting the flow control valve. Flow control valve. There is a flow control valve here. Okay, here. Okay, that if you adjust, then the PEEP is adjusted. But in here, it is not very much recommended. So hence, this PEEP is not very much um, consistent in bag and mask ventilation. Okay, so you have to have an additional valve attached, but then it is not consistent. So hence, for free flow oxygen and for CPAP, it is self-inflating bag is not recommended because CPAP PEEP is not consistent. For free flow oxygen, it expands by itself. Okay, so you cannot give free flow oxygen through self-inflating bag. If at all you want to give um, means free flow oxygen, when then we give for the rear end of the self-inflating bag. Okay, here yes, in these two conditions, yes, you can do give CPAP and free flow oxygen. Then what are the safety features? Yes, pop off valve is there, and pressure gauge means the manometer. You can connect the manometer and see how much pressure you are giving. Again, here also the pressure gauge. Here, maximum relief pressure valve is there. Okay, you set it here properly, maximum pressure relief valve. Okay, more than that, it will open, it will pop off. Okay, so these are the safety features. So now I think you can understand what is the difference between self-inflating, flow inflating, and TP resuscitator. So these three are the things which we give positive pressure ventilation. But usually in limited resource setting, this is most commonly available, the self-inflating bag. Okay, so what are the initial settings of the positive pressure ventilation? Okay, one is see oxygen concentration. Now recently there are a lot of studies going on, and the latest guidelines in 2019 or 15 onwards, they recommend the lesser the oxygen saturation, the better is the outcome, because oxygen is also a drug which leads to adverse outcomes. So hence, for any delivery, even if you for term babies more than 35 weeks, you need not have an oxygen resource immediately available. You have to have just ventilate the baby with room air. Okay, 21% is the oxygen saturation required. So if you have just a bag and mask, properly functioning bag and mask, you can immediately start on resuscitation with 21% or the room air oxygen. ठीक है. And for less than 35 weeks also at room air, or the maximum required is 30%. So now the focus is on ventilating the lung, okay, not on other things. Then gas flow. See, gas flow is for what is it? Flow inflating and TP resuscitator. How much you have to achieve? Then the rate at which you have to give. So any positive pressure ventilation you have to give 40 to 60 breaths per minute. Okay. So how do you count? Means you cannot see watch every time and do bag and mass. So then what do we use is 1 2 squeeze, clamp, 1 2 squeeze, 1 2 squeeze. So then you achieve a rate of 40 to 60 breaths per minute. Okay. Then the PEEP recommended is 20 to 25, and sorry, PIP is 20 to 25 and PEEP is 5 centimeters of water. Now, yes, this is the latest. How do you know if it is positive pressure ventilation is going properly or not? Now, there is a recommendation which says yes, whether chest wall is moving or not bilaterally. Second thing, air entry bilaterally. You have to check the air entry bilaterally. But recent guidelines say carbon dioxide detector will help in assessing the whether the proper positive pressure ventilation is going or not with carbon dioxide detector. So this is a calorimetric carbon dioxide detector. I do not know whether you have seen any capnograph. Capnograph is a carbon dioxide detector which lies in between the bag and the monitor. Okay, it is connected to the monitor, and it will directly give an electronic reading, okay, of the carbon dioxide level, electronic reading directly to the monitor. Okay, this is image wherein calorimetric this is a carbon dioxide detector wherein initially it is purple in color. Once carbon dioxide touches this um, uh, indicator, then it is yellow. Okay, so the change in color is the indication of proper positive pressure ventilation. So this has recently been recommended. Okay, now where else we can use positive pressure ventilation? Even if the heart rate is more than 100 and the baby is breathing, but the baby's oxygen saturation is not maintained within the target range with free flow oxygen or CPAP. You are giving, see, baby is more, see here, baby's heart rate is more than 100 and baby is breathing properly, and you have given oxygen or CPAP, but the target range of saturation is not attained at to that level. Then we can use a trial of PPV. This is a recommendation latest. Now here I was telling you breathe 2 3 or squeeze 2 3. Okay. Now, how do you assess whether our positive pressure ventilation is improving, means baby's condition is improving or not? See, within 15 seconds of starting PPV, every the time you start the PPV, you have to record, and within 15 seconds of it, you have to assess the heart rate. If it is increasing, then it is positive. It should improve. Okay, or within 30 seconds, the heart rate should be more than 100, though it is improving but not attain the target of more than 100 within 30 seconds, then there is something wrong with the PPV.